Well, I guess we're on the road again, and this time we're at the studio. And I have here Martha Kurilec, who's a geriatric dentist, and Mary Rolka, who is a geriatric dental hygienist. Yes. And they've been telling me about a business. I've heard about it a little bit from over the years because Martha and my relationship have talked a lot about it. And I think it's exciting and very beneficial for people to know the information. So I would like Martha or Mary to kind of start and tell me, first of all, what's the name of your consulting business? What are you doing with it? How did you get interested? So I've thrown out about 3 questions, so I'm going to let you go any way you want.
Okay, well, I'll start. Thank you for having us. Well, the name of our consulting business is GeriDent Solutions, and this concept has been in the planning process for a long time. Mary and I have both been in the field of dentistry, seems like forever, and over the last 10 to 15 years, our focus has been predominantly in treating older adults. We provide care in a nursing home setting, for the most part. And, you know, we've seen over the years the transition of what's been happening in nursing homes and what patients are getting in terms of care and what they're not getting. And, you know, we're familiar with the federal and state regulations regarding what is supposed to be happening. And we're acutely aware of the fact that there just aren't a lot of providers out there.
Now, has things changed with the state in recent years? Or?
Things have. The federal regulations that oversee the rules and regulations that dictate what should happen have not really changed. But on a state level, with reimbursement issues of how providers get paid has changed, and things have gotten tight. You know, times have gotten hard and states have cut funding, and we're very fortunate that in the state of Connecticut, services for the elderly in terms of dental care have not been completely cut. But the budgets have gotten tighter, and we have more hoops to jump through, and so that said, that does really affect the amount of care that is going to get provided, because it's not attractive for a provider to be in this setting if they can't get reimbursed for their time or at least cover their costs. So that has had a negative impact on dental services. I know that there's similar type things happening medically in terms of Medicare and Medicaid payments, and it's unfortunate, but that's just the way things are, and it's impacting everything. So the bottom line regulations of state, it's just the reimbursement process that has changed, that has had a negative impact on the amount of care getting provided. So yeah, things have changed in not a good direction.
And then our concept was, well, let's make this a little different, because we knew in most nursing home settings that dental care meant generally a dentist would come in and provide whatever care could be provided on the site, and that was about it. And me being a dental hygienist, I sort of saw it from a dental hygiene point of view. Well, why don't we provide dental services and dental hygiene services? Because we were getting, anecdotally, I was getting calls from families, and Martha was hearing from families that nobody's taking care of my mother's teeth, nobody's brushing my mother's teeth, and you know, it's very difficult, and even from nurses. And so we thought, well, if there was a presence at a nursing home that started with cleaning teeth, started with a preventative program, and the preventative program then led to referrals for the dentist, then there would be somebody on site all the time for these people.
And has the laws changed for the dental hygienist in the last few years?
Good question. Yes, the laws have changed. How how many years ago now? 4 or 5?
4 or 5, could be 6, but
4 or 5 years ago, legislation was introduced and passed that allowed for dental hygienists to work independent of a dental supervisor in certain settings. Those settings needed to be settings of need. Inner city clinics, schools certainly, and certainly at nursing homes. As soon as that law changed, gosh, it's got to be more than 5 years then, because as soon as that law changed, I jumped on it because I was already, Martha and I were already at Avery Heights up in Hartford. Yeah, we were already at Avery Heights up in Hartford, and as soon as that law changed, there were people there that were independent living that wanted to have their teeth cleaned, and I was able to do that, so I just started doing it. And nobody ever questioned it. And then I started seeing the people independently in the nursing home itself.
So that means a dentist doesn't have to be there on site. Where
no.
before, wasn't the law, I may be wrong, but wasn't it that a dentist always had to be on site?
Yes, at one time.
Yeah, that may be a long time ago, but I think
there was a subtle change. Initially, it was direct supervision, so the dentist had to be on site. Then it became, it didn't have to be direct supervision, the dentist had to be accessible, and that was defined in the laws. But still, the dental hygienist could not work independently of that dentist.
The problem with a dental hygienist working independently in especially in a nursing home setting is that, as Martha said, there aren't a lot of providers providing dentist providers providing services in the homes, and if we're going to go there and provide services independently, we need a referral source. So if I go in there and just provide dental cleanings and I identify a cavity or a loose tooth or something that needs to be seen by the dentist, if I don't have a referral source, then I'm putting my license on the line because I'm not there to diagnose, I'm there to clean their teeth and
and make sure they're getting
which is why our relationship, you know, grew.
So let's step back a little bit. So you two have both worked geriatric dentistry in some fashion for years. And now you've gotten together, and what are you providing, and how does this work and everything else?
Well, we understand the significance of prevention and the importance of oral hygiene, especially in the nursing home setting. And over the years, we had the opportunity via our nursing home care to see that if a good prevention program was in place, it minimized everything else. The problems were few and far between. We had healthier people. We had a quality of care for the residents that was so much better. And so what we do as GeriDent Solutions is our focus is in setting up oral hygiene prevention programs in a nursing home setting. And everybody will get a screening and an assessment, and they get their teeth cleaned, and they get set up for a recall so that they're seen at least twice a year. And again, when you have a clean, healthy mouth, it impacts the rest of the body. I mean, we have known for years that the mouth is connected to the rest of the body and can have an effect on your general health. For many years, we didn't have the research to substantiate the belief that we had. But within the last, it was either 5 to 7 years ago, research began to come out into the community that proved exactly that showed that the mouth is connected, it has an impact. In particular, inflammation in the mouth has an effect on the heart. And I want to say that I'm sure people listening to us right now probably will remember something they've heard on television or their dentist tell them, or they may have read it in Prevention Magazine. The articles are out there now. The TV interview spots are out there. Today's show has done little segments on exactly that, how your periodontal health, how the health of your gums can affect your heart. And now we have that information to back up what we sort of knew. We just couldn't back it up with any research. And now the research is there.
The research. Is there research, any other kind of research with the body, or has that been mainly the heart they focused on?
The seminars that I've gone to focus on the heart, but they focus also on inflammation. And inflammation can impact so many other things in your body. But the interrelationships of dental health and general health, there are many more than just the heart. You know, one of the things that I tell people when I talk about geriatrics, and I'm oftentimes asked, well, how is that different from regular dentistry? Well,
good question.
Dentistry, you know, a filling is a filling is a filling. There's a variety of ways that we can do it, but the bottom line is, you know, if I do a filling on you, it's going to be no different than a filling that I do on somebody who's 20 years old. Whether I do the filling on you is what's different. And when we deal with an older adult population in a nursing home setting, we're oftentimes dealing with sicker individuals, frailer individuals, and it's the decision-making process that differs. Do we do the filling? Do we take the tooth out? Do we make the denture? And we look at the person as a whole in terms of everything else that's happening to them. We look at their medical, we look at their social, we look at everything, and then we make a treatment plan and a decision process regarding what we do for them dentally. That's the difference. The dentistry portion, the fillings are the same. You know, it's the decision process that goes into what we do on these individuals that is a little bit more, can be a little bit more complicated.
So if somebody needed dentures, is that something you provide, or dentures?
No, dentures is one of the services we provide. We remove teeth, we do fillings, we do a lot of oral hygiene, oral health. That's predominantly our focus. And as we go in and we assess an individual and if we provide that dental cleaning, we see what their need is, and then we address that need. Anything that we are not able to provide for them, for whatever the reason might be, they might be so severely medically compromised or frail that they may require a referral into a setting that can handle that can manage their care better than we could on site. We would refer that person out. We'd work with the medical staff to get that person referred. We have many residents in a nursing home who come in for short-term rehab. They're there perhaps for a recovery from a replacement of a hip or a knee, and they have their own providers on the outside. And they understand that they may not get to that dentist because they may not be able to get there. And they'll ask us, could you please clean my teeth? Well, we'd be happy to clean your teeth. There are some that live in a nursing home setting that are still relatively ambulatory and have a means of getting to their own dentist. And we encourage them to maintain that relationship. We let them know we're there for them if they need us. And that's basically how we handle it.
Well, and also the dental hygiene, and the dental hygiene portion of it, as Martha said, the dental hygiene or preventative portion of our business is the predominant part of the business. And one of the reasons for that is because we place a dental hygienist in that setting.
So you have one dental hygienist at that setting.
Right.
Correct.
And that's kind of their own little turf.
And it is their own little turf, absolutely. They are working independently.
And how often do they show up?
Usually, depending upon the size of the home and the needs of the home, usually a bigger home, it's going to certainly be once a week. We have a couple of homes that are a little larger. Smaller homes, it'll initially be once a week, and then maybe the hygienist will see that in order to keep up with the cleanings, they only need, and any referrals to doctor, they only need to be there once every 2 weeks. We try to be there more than once a month.
Right.
So that means if a nurse sees something or something, they can just say, hey, can you just take a look?
Absolutely. So
that means somebody's kind of constantly
there
for the teeth
Correct.
and the mouth.
Absolutely. We're a constant presence, and that's what we like to emphasize when we talk with a new home, is that we want to be a part of their facility.
So you're part of their staff, and the dental hygienist becomes part of their staff,
Really
just
does.
like whether you're a nurse or an aide or a dietary, whatever your
It's been
role.
met very well so far. One of the hygienists that we have has a few homes, and the staff all know him and welcome him. And yes, if there's a problem, they don't have to worry about that. They have to call doctor first and see, is this an actual emergency? Would doctor consider this emergency? They ask the dental hygienist triages the problem, and then the dental hygienist sometimes can decide, oh, well, no, that was just, something they ate, made their gums swell, or
get a little under the ground.
Right, or is going to call doctor and have doctor come and take a look at it. So they love that they have that intermediary person.
And what can, one of the reasons I thought it would be great to talk to you is letting the public know what should be supplied in a home. Say there's a grandmother, a mother, or a loved one, a spouse of some sort. Should they be seen is that something that should be routine in a home, or is that just starting out now?
Well, the federal guidelines state that all residents in a nursing facility minimally should receive a thorough examination once a year.
Okay.
Individual states embellish on that in terms of how many times a year they might pay for a cleaning, for instance, or suggest that they get their teeth cleaned. Again, that's more on a state level. The federal guidelines are more particular about making sure individuals get seen. If a need is identified, the home is responsible for making sure that that need gets addressed. How they go about the details of that is left up to the home.
Okay.
So they're generalized guidelines, and there's a handful of them. There aren't tons of them. And they do leave the specifics up to the individual homes. The states, depending on what state you're in, may add some nuances to those. But again, the details of how these things get implemented are left up to the home.
So if a family goes in, they could just ask what they're at the desk, or would they be expected? Who should be overseeing it? Is it the family that oversees, or is it the who determines whether Grandma Moses gets the teeth cleaned? Is that the families, or
well, the family should ask good questions
right?
When they're deciding on a home for Grandma.
Yeah.
They should ask good pointed questions. I mean, I'm sure there are things they think of all the time. Is my grandma's laundry going to be done?
That's correct.
Is she getting her medication every day? What kind of meals is she fed? Who monitors her? And maybe people haven't thought to ask, and what kind of dental care is she,
I think you're probably
going to receive. And if I was the family member, and I know, Martha and I both know a few family members that have had this situation, and we give them the questions to ask. What kind of service is provided for dental? Do they get their teeth cleaned? Who cleans their teeth? How often do their teeth get cleaned?
And who provides?
Exactly.
Do they bring somebody in, or do they have to go to their facility, et
exactly.
cetera?
Do they have to go off the grounds?
Or how does that work?
Then there's a whole. Then if they have to go off the grounds to have work done, then there's the whole issue of
how
transportation.
How
exactly.
And I assume, but maybe I'm mistaken, do the families or the patients pay for this service? Or does that vary?
That varies. That varies based on the situation of the individual. If the person coming into the nursing home setting is a private pay individual, then it would be, for instance, Medicare, if they're 65 or old. Medicare, unfortunately, does not pay a penny for any dental work.
That's what I thought.
Historically, they never did. They do not at this time. It's unknown whether that might come in the future. So Medicare is not a payer source. So if the individual is deemed private pay, perhaps they might have retired with dental insurance, and if so, then their dental insurance would reimburse, and if there was a balance, the individual would get billed for that. They might come into the facility as a Medicaid recipient, state of Connecticut. Medicaid does cover dental services, albeit limited, and unfortunately, as of July of last year, it got even tighter. But again, thank God they didn't eliminate coverage altogether. And Connecticut, for the most part, compared to many other states that I've looked into on the computer, is better than some. So we're very fortunate that Medicaid still does cover a lot of the basic services in emergency care. So it really depends. They might come in as a private pay and spend down and become Medicaid. It's just, it varies.
It varies. So if I guess the message would be ask. The family
Correct.
should be asking.
Correct.
Because of the benefit from heart and other kinds of things that I think there's been talk, if not research, about different things. For instance, with the lungs and the different things like that. Is that true, or?
I'm not quite sure what your question is.
Okay. Well, we talked a little about the heart. You said inflammation.
Oh. I thought you were using an acronym for a company out there. Okay, you meant the actual heart. Okay. Yeah. Well, I myself would love to see that natural transition from, hey, look, we have the research to now substantiate the concerns and the understanding we had about the connection between the mouth and the rest of the body. Maybe now there might be companies or organizations or the government itself in some way that makes it a little bit easier to provide funding to get people in that environment, or at least reimburse for those services. I don't see that happening anytime in the near future, but that doesn't mean it may not happen. But now
Especially for
we
the
can
medically compromised.
exactly. I mean, the research is there now. It becomes more of a real thing that you can kind of touch. And you know, it's a slow process, but it might happen. You know, one of the things that Mary had mentioned earlier regarding how things are set up with the hygienist, when we go to a facility and we speak with an administrator, we make it an important point to let them know that we integrate into your staff and we become part of your team. And we work collaboratively with your staff. It's important to establish a good communication system so that you can contact us as you need, and there's no guessing. Or, you know, one of the problems the nursing home has had is they will have identified somebody that they think might have a problem, and then they kind of like didn't know where to turn to, or they couldn't get anybody to address that question immediately. We establish a communication line so that they can get a hold of us. And again, our hygienist is our first line, and you know, we educate. Education is so important. You know, we learned a long time ago in our careers that, you know, what we think is an emergency and we understand as emergency isn't quite what that other person might think an emergency is. You know, if somebody has a canker sore in their mouth, they're going to have some pain. They may not want to eat. They might run a slight fever. Is that an emergency? Well, it could be, but it's not the same kind of emergency as if somebody had an infected tooth and they were swollen, and now we're dealing with, you know, a whole different situation. So we educate as we go on, and when we're there, when we interact with the staff on a daily basis, we educate, we teach them. And they appreciate that because it becomes this whole new world. And, you know, now all of a sudden what they might have thought is an emergency really isn't. It might just be that they have a denture sore and their denture needs to be adjusted. It's not a life-threatening infection that's going on here. So that's the other thing that we set up and we establish. And the feedback we've gotten from staff is tremendous. They're so grateful for that.
That's nice. That's very nice. Now I'm going to ask kind of a simple question. When people are in a home and not maybe a rehab home, who makes sure they brush their teeth? Is that something that's done routinely? Does in homes? I mean, are they given a brush? Do they brush their teeth? What? Maybe Mary, you're probably.
That also depends on the resident or patient themselves. It depends on their mental status.
Yes.
And even those who might not have an altered mental status, sometimes they just don't want to bother. And I find that the people that have had good oral hygiene in their younger years will more than likely have good oral hygiene as they're older. And that's evidenced by the independent people that I see. In the nursing home setting, in the skilled nursing units where they need their cares met every day, sometimes we're the first line of communication with the staff to let them know that maybe Mrs. Smith is starting to need some help with her oral cares. Because quite often what they'll do, even if Mrs. Smith has an early Alzheimer's, she can still function, she can still do many things herself, so the general wisdom is the aide will come in the morning and put toothpaste on her toothbrush, and Mrs. Smith, your toothpaste is on your toothbrush and it's in your bathroom, and then the aide comes back in and the toothpaste is gone, and maybe Mrs. Smith simply sucked it off and swallowed it. So then,
like my two-year-old grandson.
So then, by the time we see Mrs. Smith, we as hygienists and as the doctor would too, we can tell whether or not
they are taking care
of done. And then it's up to us to call the staff and say, well, who is doing Mrs. Smith's cares? Oh, well, she's doing her own. Well, we highly recommend that the aides make a suggestion that they'd like to help her. And by suggestion, I mean you kind of walk a fine line there too, because you're trying to keep Mrs. Smith as independent as you can for as long as you can. But if it's starting to cause inflammation that's going to be detrimental to her, then we try to make a soft suggestion that maybe we could help. And quite often they will let you help, because maybe their hands are arthritic and they really can't handle that too much anymore. So they'll often let the aides help. But quite often it's us that sees that first, and we make that suggestion to them. But yes, their teeth should be brushed, and the aides are usually the ones that do their cares every morning and evening. So they're the ones that should be doing it. So we go right to them when we do. Yeah.
We, again, that's part of that educational process. When we're there and we identify a situation that might involve what Mary just described, we'll actually work with the aide and to show them and help them and give them some helpful hints about how they can improve the oral health of the individual. But sometimes it's a matter of little tricks of the trade that we've learned. You know, sometimes trying to get into a patient's mouth is a little difficult, and the oral cavity is very intimidating to healthcare professionals that aren't dentists or dental hygienists or dental assistants. And I don't know, there's this fear, I don't know what it is, but it's a detriment. They
don't want to do it.
They don't want to do it, you know. So we kind of make it not scary for them.
Oh, that's good.
And they're appreciative of it. We also provide in-service training for the staff in the facility. I believe there are regulations that nursing staff on all levels, RN, LPN, and CNA, have to have so much, I don't know if it's per hour or per class, but they have to have in-service training per year, and dental is part of that. So we do provide them with that. And we try to turn it into, and you know, we focus our attention on CNAs because they're the first line of defense. They're the ones who go in and provide that care.
They're the ones that are actually...
Absolutely.
You know, residents in the nursing home get toothbrushes, they get their toothpaste, they get denture cups if they wear dentures. One of the things that we try to encourage, and we do, is get those dentures labeled. That helps.
I would think so.
It doesn't necessarily prevent them from being lost, but it prevents them from ending up in somebody else's mouth, which has happened. You know, but trying to take away the scariness of it helps.
And
but
the in-services we provide to the CNAs, of course we're teaching them about oral hygiene and about what's important and what you're taking off the teeth and how you're making the teeth and the gums healthy. but we also gear it toward the CNAs themselves, which kind of they can relate. This way, they can relate to it a little better. So it's how clean you keep your teeth, how clean you keep your children's teeth.
Yeah, interesting. Interesting.
Right. So, and we, give them toothbrushes and give them things so that they can try them at home, and then hopefully they're going to pass some of that on in the home itself.
Well, we also try to make them understand how important they are. They may technically, in the eyes of some people, be on the bottom of the totem pole, but they may save someone's life.
That's true.
When they're cleaning their residents' teeth, we teach them what is normal and what isn't normal. If anything is there that wasn't there before, or it just looks different. There's never ever a silly question, or if you're going to make a mistake, I'd rather you make it on the side of safety. If you brush Mrs. Smith's teeth and something doesn't look right, let the nurse know so that they can let us know. They may have just identified an oral cancer early, and now we can step in and address that issue. Right. So when they understand how important their role really is, I mean, it makes them feel better about themselves, and we have seen a turnaround in their attentiveness to the residents, and that's key. I mean, they are very important to the success of our program and to the success of the care that the patients receive in the nursing home setting. They just need to feel that somebody acknowledges that.
Because their role is important. Absolutely. They're the first one.
Absolutely. I remember once talking with you about the issue of pneumonias. And people don't think about this, but if they stop to think about it, they would see the connection between poor oral hygiene and respiratory health, for instance. If you didn't brush your teeth and plaque was accumulating on your teeth and food was accumulating and you weren't cleaning that out, and you aspirated or breathed in and you accidentally breathed in a piece of that, well, you've breathed in a hunk of bacteria, and if that goes into your lung, it's likely you might develop a pneumonia. Well, what I just described isn't often that unusual in a nursing home setting. And if an aide can go in there on a regular basis and make sure that Mrs. Smith's mouth is clean, that's not to say it wouldn't prevent something, but the likelihood becomes less.
If you keep the plaque down, and if you have somebody coming in to check and make sure that they don't have plaque on their teeth, and I can understand how that could happen, and get a piece stuck down.
Absolutely. And one of the reasons, certainly the most important reason for there being a large amount of plaque and actually food debris, the number one reason in the mouth of an elderly is their mouths are dry. Their mouths are very, very dry because of medications they're on, because they're older.
So that's a real problem with the elderly, dry mouth.
Terrible problem.
And do they, I kind of know the answer, but I know that a lot of times people get dehydrated and not aware of it when they get elderly.
True.
Because they don't have the same senses, or they're not as acute.
And and even when we identify people with dry mouth, I mean, we have a couple of tricks of the trade that we can use to help moisten their mouth, but we always encourage them to drink, and for some reason, maybe that reason, I suppose, the elderly aren't like us. We have our bottle of water with us. We're sipping on water.
I wonder what the boomers will be.
I
wonder
if they're going to have a hole attached to their sides. The little harness.
Exactly.
That's right. But maybe maybe because it's so ingrained in them that they will. I don't know, but I know I have
age do
not drink, and they say I'm not thirsty.
Yeah, exactly.
And they don't want to have anything to drink.
Exactly.
And also the patients that are NPO, which means you can't take anything by mouth for whatever reasons. What kind of care can they expect, or what should be done with that type of patient?
Well, they should receive the same kind of care that somebody who isn't NPO. They minimally should be examined on a regular basis, on a daily basis, and there are methods and techniques of cleaning the teeth that are different than what you and I would do in the bathroom. We would minimize the amount of water we would use, but we use 2x2s or 4x4 gauze sponges. We can use a toothbrush. We use less water. There are techniques that we can use. That mouth could still get clean. You just approach it differently. And obviously you need to be careful, because if they have been diagnosed as not being able to swallow, you wouldn't want to introduce a lot of water.
Right.
Or anything that they could accidentally aspirate into their lungs. So again, that's where the teaching piece comes in. We would take that aid aside and we would assist them in learning how to provide the proper oral care for that individual, but their mouths should be cleaned every day just as well as everyone else's, because in this particular instance, they are at a higher risk for aspirating that piece of food or aspirating that chunk of plaque, and now you've introduced bacteria into their lungs and they could develop a pneumonia.
Which segues nicely into a program that we're going to be getting involved with. I'll let you explain it, Doctor. At a few of the homes where we are now.
We're actually in the process of learning about this. It's called the Free Water Project. And there is a group of nursing homes that looked into the situation of these individuals who are NPO and technically aren't supposed to have any water. They can't sip, you're not supposed to put any water in their mouths. And they looked at the quality of life issues here, and they understood the significance of maintaining a healthy mouth, a clean mouth, to help minimize the pneumonia type situations that can happen. And they, and this is the gray area, because again, we're learning more about this and we're trying to get some of the literature that they've put together. And they're trying to introduce a program where there's a high intensity in training their staff in providing oral care for these residents, and in doing so, they're also introducing water to those individuals who may be able to swallow, and it's tiny amounts of water, and they're allowing water to be used to be able to clean their teeth, and that's kind of the best handle I have on it right now, but we're anxious to learn as much as we can. This, I believe, is in conjunction with Yale New Haven, I think. But
there is also a program with Yale New Haven. I think they may be separated.
But kind of on the same,
kind of on the same level.
More and more, I guess, more and more research, and that's certainly what we have to read. There's more and more research to suggest that as an end-of-life, quality of life issue, small amounts of water are not what caused the pneumonia. The condition of the mouth that the water is going into
is what's causing
the pneumonia. And that's a good point. That's a very good point. And you know, while I'm talking, you're talking, I keep thinking, oh, I'm getting thirsty.
Yeah.
I mean, and can you imagine not having anything to
right.
Never, or thinking that you're never going to even have a little.
Exactly.
I know that they swab the mouth, and sometimes they will allow ice chip, but not all the time.
Not all the time.
Because if they can't swallow, they can't do that. So can you imagine?
Well, and I used to think of NPO patients as being patients that were either comatose or in a vegetative state that didn't know the difference. But I have met at least 3 individuals from a couple of the nursing homes where we've been that were quite friendly, and they knew they weren't supposed to swallow, and they knew they couldn't take water in their mouths. So every day they lived with the thirst that we're talking about. Every
can you imagine?
Right.
Yeah. So we're learning more about this.
And I'm not so sure, even if they're comatose,
that
they might, even though they may not be able to express it, because there's such different levels of being in a coma. So I can see where that could be a real. And
I have to applaud this group of homes in taking that approach. And from what I understand, the challenge was for them was to get the physicians on board.
Sure.
Because the order had to be written. They can't do this unless they get approval of the medical staff.
Right.
And so how they're working that out is interesting. But we have a lot to learn on this, but it's exciting to be part of that program. I imagine I see them putting together some of their own research and then presenting that. And this might be a trend coming down the road.
So we may be hearing more about it in the newspaper and the Today Show, et cetera, just like what we did with the heart.
Exactly.
Right.
Very good. Well, it sounds like the biggest message I hear is that people with their loved ones in home situation need to be proactive.
Correct.
And go and talk to people
Very
and make sure so that there's no plaque or as little plaque as possible. And if there is, now I've heard people say, well, I only have a few teeth, so I don't need any dental care, and it's expensive and things like that. But and again, that's education.
Absolutely.
You're educating the staff, but also the public needs to be educated. How important 2 teeth is, whether you have
or 30.
Or
Yes,
30.
right.
And also the patient, because again, with the population that we have and the time from when they might have dentures, and they'll look at us and they'll smile and laugh and they'll say, oh honey, I have no teeth, I don't need to see the dentist. And of course, it's not just teeth. I mean, when we do an exam on an individual, we're checking the condition of the soft tissues. We're making sure that there isn't a cancer going on in there. So it's not just teeth. It's the whole person.
It's also if the dentures are fitting correctly,
Sure.
because a lot of these dentures, you can see the mouth going and the
Yes, you
denture's
can.
going the other way around,
Yes, you
and I'm sure you can help in some way in that way.
So it's an education of the patient sometimes also.
Yeah.
But I would say yes. I think a family member needs to be proactive. I see more and more articles coming through the prevention magazines regarding exactly that. You know, what to do if you know you're going to go into a hospital setting, for instance. You know, the do's and don'ts and how to advocate for yourself or advocate for a family member. And, you know, if an individual has a loved one who might be going into a nursing home setting, it would be nice if they did say, and, you know, who will be providing the oral care for my mom? And what do we do if there's an emergency or that sort of thing? Sometimes just asking that question will reinforce the need for it from the administrator's standpoint, and if it and it will be more forthcoming.
Right, and I think we've found in our dealings with the nursing homes, the people that are now putting or have put loved ones in nursing homes are generally sort of our generation. Their parents are going into nursing homes or have been diagnosed with a problem that makes them need to be in a nursing home. And I don't want to pat us on the back, but I think we seem to be more aware of dental issues because we were sort of raised with it. My father and my mother were raised with, well, by the time you're 60, you have dentures.
And then the other part was, then you didn't question anybody.
That's
right. I mean, that was nothing. You didn't ask about that.
My mother doesn't, right?
No,
if I
that
go to the doctor with her,
she's not going to ask anything. No, nothing at all, because that was not polite to question.
We've sort of come into the computer age, certainly not as well as our children, but we've come into the computer age and we have questions and we know how to look things up, and we are going to advocate for our parents going into those type of settings.
Yeah, well, it's now considered the best you can do, where before it was you need to keep quiet, they're taking care of, and that's no longer true. They want your input.
Right.
And I was just thinking while you were talking, if someone gets in a car accident, nobody thinks about, not at the moment, which they shouldn't be, but they could be in a home for months, and nobody's thinking that way.
And
I mean, that's right. That's right. Nobody's thinking, oh well, we need to think about his teeth or her teeth.
Right.
So that's lots of things to think about.
Right.
Families should be aware that the state of Connecticut, and as all states, through the Public Health Department, has surveyors that go to nursing homes at least once a year to make sure the homes are doing what they're supposed to do. It's a survey process. There are guidelines that they follow, and one of the things that they check to make sure is happening is dental care, or at least attention to.
So they're very
correct.
big. So they're very big on doing that.
More and more.
More and more so.
I don't think
More
at one
so
time
now.
they were at all. No.
Well, I don't know. I don't know how they work and how they decide what their priorities are, but sometimes there's an emphasis more on one thing or another.
I think they're always,
Yeah, and I think it might have to do with whatever the more prevalent problem is at the time, but lately, the last couple of years in particular, they're starting to turn their focus towards the dental care
it
of the
sounds like
individual.
that's important that they do.
So there are, there's somebody who's going in there and they're making sure that at least the guidelines are being met.
And that means that there is a place, there is an avenue for the family members. I myself have had a couple of friends whose family members were in the convalescent home, and no matter what they did, they could not get, and one in particular was dental, believe it or not, could not get proper dental care for her mother.
Really? That's
and
sad.
She went from down the line of command to the administrator to the DON. She went all the way down the line of command and could not get anything done for her mother, and she turned them into the state.
Oh, wow.
And the state, I mean, there were a couple of other issues that her mother had that she didn't think were being addressed, and she brought the state in, and she told me that the state person said to the administrator, brush this woman's teeth. This isn't rocket science. Brush her teeth. So there are avenues for people, too, if they don't feel like they're being heard.
That's good to know, too, that they, you can. Well, I thank you for coming today. Is there anything else that you feel we haven't covered?
Oh, golly.
Golly.
There's so much we could talk about. No, we thank you for inviting us.
What other things do you think might be important to point out?
Well, I think we covered the most important issues.
Okay.
I do.
Okay.
I think the
Okay.
most important issues we've covered, which were...
And you asked good questions.
You asked very
Well,
good.
thank
You know,
you.
it's being proactive, asking the questions, and not being bashful about doing so. And just reminding those that are aware of it and informing those that are not that the oral health, the health of an individual, oral health is very important to their general health and needs to be maintained in that setting.
It's very important when you start talking about heart and
When you
talking
think
about
about
plaque. I mean, you're not just talking about, oh, let's have shiny white teeth.
Correct.
Right.
But there's a real reason.
It's not an
and I
aesthetic
think
issue.
everybody's starting to realize that every part of the body
Correct.
affects.
Connected in some
And
way.
Well,
for a
if you
long
don't take in the nutrition you need because you can't eat for whatever that reason is, that's going to affect your general health. So,
It all starts in the mouth.
it all
That's
starts
right.
in the mouth.
That's right.
exactly right. So,
Well, thank you very much, and
Thank
good
you.
luck.
You're very welcome.
Good luck. I think what you're doing is great for everybody. So
Thank you.
Thank you.
Thank you very much.
Appreciate it.